Hello everyone, my name is Dr. Asma Farooq. Today's lecture is about digital health policy with a focus on digital health vision and e-governance in health. Before starting the lecture, I would like to sincerely thank the Universal Digital Health team and the organizers for giving me this opportunity to share my knowledge with you. In this lecture, we will discuss the digital global health and its vision, e-governance in health. We will identify the main global actors and what are the policy levers. The present policy that was from 2020 till 2025 and now it has been extended till 2027. We will see what are the milestones and implications of this policy. And at the end, we will discuss the real toolkit for countries. Starting from the definition, digital e-governance is the strategic use of information and communication technologies to make government operations more transparent, efficient, and participatory by enabling seamless, secure, and citizen centered digital interactions. These digital interactions are among the government, citizens, business, and other stakeholders. You can say that governance deals with the laws, policies, standards, procurement, financing. It covers the data rights. It ensures safety, interoperability among different systems, workforce, and finance. And the goal is to achieve the safe, equitable, scalable digital health services. In plain language, we can say that it is a digital steering wheel. It keeps all health related information and communication technologies and other initiatives like the telemedicine, electronic health records, artificial intelligence apps related to health, health data exchange, mobile alerts, and other devices that pointing in the same public interest directions. In governance, we decide that who will decide, who pay, who will keep a check on it, and who will protect. Goal is the prevention of new fragmentation, risk, or inequalities in the global health. Digital e-governance in health is the system of rules, institutions, process, and tools that government use in the digital transformation of the health sector. It is basically a rule book or a referee and skateboard that turned the isolated digital health pilots into a coherent, sustainable national system serving every patient and the healthcare worker. Vision of the digital health is not just the technology. It strengthens every stage of healthcare from promotion to the prevention to diagnosis, treatment, rehabilitation, and palliative care. Digital health provides us the solutions that are person centered, affordable, and sustainable. And it is not just about the technology, it strengthens every stage of care from health promotion till the rehabilitation and includes all the aspects of the healthcare. It also helps countries prevent, detect, and respond to epidemic and pandemics. COVID-19 is the recent example. By using health data smartly, digital health pushes us toward the sustainable development goals and WHO triple billion target. We have discussed this VN in the previous lecture as well. Let me tell you again, the triple billion target is that 1 billion people covered by the universal health coverage, 1 billion people will better protected from the health emergencies, and 1 billion enjoy the improved healthcare and well-being. Achieving this vision takes the innovation, collaboration, and strong investment, especially in countries where digital health can transform lives the most. Now comes to the core values that will help us to make this vision real. First is the solution must be accessible and equitable, so no one is left behind. System needs to be efficient, affordable, and sustainable. Meanwhile, it respects the privacy and the ethical standards. These pillars are here to ensure that digital health not only tackles the immediate health challenges but also empowers communities, strengthens health systems, and create long-lasting impact. Following these principles is the key to turning ambitious goals like the triple billion targets into reality. Success requires continuous innovation, collaboration across sectors, and investment in governance, workforce, and infrastructure, especially in the middle and low income countries where the potential for transformation is greatest. Here we will discuss the key domains in the digital health governance. This table outlines the main domains of digital health governance and the typical questions that policymakers need to address. Let's go through them one by one. First is the policy and strategy. Here we ask whether a national digital health plan exists. Are priorities clearly defined? Are timeline and budget published? Essentially, this ensures that digital health initiatives are planned, coordinated, and funded at the national level. Next is the standards and interoperability. Standards define how health data is structured and shared. For example, HL7FHIR is used for data messaging, ICD-10 for diagnosis codes, and SNOMED-CT for clinical terminologies. Interoperability ensures that different systems can communicate effectively and securely. Data privacy and security. This domain focus on who can access health data, under what legal framework, and what cybersecurity controls are in place. Protecting sensitive health information is critical for trust and compliance. In telehealth and remote monitoring, we consider whether online consultations are reimbursed and how quality of care is measured remotely. This ensures telehealth is integrated effectively into the health system. In monitoring, evaluation, and funding, finally, we track the key performance indicators like service coverage, uptime, user satisfaction, and health outcomes. We also plan the long term funding beyond pilot projects to maintain sustainability. Together, these domains form the backbone of digital health governance. They ensure that digital solutions are safe, effective, equitable, and sustainable. The question is why this governance matters. Let me explain it this way, that suppose every digital health app is working separately. Like the patient's HIV app cannot share data with the maternal health app, and doctors only see part of the story. Governance fix that. It ensures systems talk to each other, giving providers a complete picture of the patient's health. It also builds trust. People are more willing to share their data for contact tracing, AI diagnosis, or routine care when they know their information is safe and private. It also expands the access, like healthcare services reach everyone through a phone, a village kiosk, or a remote clinic, helping achieve universal health coverage. It strengthens the resilience during a pandemic, flood, or conflict. System remains functional because data and services are portable and well managed. It also aligns the incentives like funding, procurement, reimbursement, all push towards the same goal instead of conflicting priorities. Governance protects the patients using their privacy, safety, and cybersecurity. These things are never compromised. Finally, it enables the scale with standard and interoperability. Solutions can grow efficiently, reaching more people without breaking the system. In short, a good governance transforms scattered apps and programs into a trustworthy, resilient, and scalable digital health ecosystem, one that truly serves everyone. Now we will discuss the key stakeholders in digital health governance. First is the World Health Organization. Its role is like to provide the global guidance and support. WHO provides norms, strategies, and technical support to countries. Think of WHO as the coach. It sets the rules, share best practices, and help countries plan and implement digital health solutions. Next are the regulators. Their function is to provide safety and compliance. Regulators like FDA in US, EMA in Europe, and national device agencies ensure that medical devices, apps, and artificial intelligence tools are safe, effective, and reliable. Their function is like the referees. They check that everything meets standards and can be trusted by the patients and providers. Then come the payers. It includes the funding and the incentives. Payers include government programs like CMS or commercial insurers. They decide what digital health services get reimbursed and funded. Think of them as investors. If they support it, the service can scale and reach more people. Then comes the standard bodies and professional associations. Organizations like HL7, ISO, AMA develop technical and clinical standards. These ensure that systems can talk to each other and that care is safe and high quality. They are the architects. They define how the digital health building is structured. Then comes the civil society and private sector. Their role is the implementation. Civil society groups, NGO, private companies, they help deliver the services, train the staff, and bring innovative solutions. They bring ideas, resources, and community connections. Think of them as the builders and innovators. They make the digital health vision real on the ground. Together, these all stakeholders form a digital health ecosystem like a team where the coach, that is the WHO, it guides the referees, which are the regulators, they enforce the rules, then the investors they fund, the architects, are the standard bodies, they design, and the builders, civil society and private sectors, they make it all happen. Let's look at the tools that make digital health work effectively in a country. Think of these as the levers that governments and stakeholders pull to ensure systems are safe, coordinated, and scalable. In national digital health strategy and regulations, we see that most countries in Europe, around 83%, they already have a national strategy. This is essentially a blueprint for the digital health. It defines priorities, set timelines, and allocate budget. Without it, efforts can be scattered and chaotic. In interagency committees, we see that digital health is not just a health ministry issue. Committees bringing together the health ministry, ICT authorities, finance, and telecom regulators to ensure that everyone coordinates. Think of it as a team meeting where all the key players plan together. In data protection acts, we all know that privacy is critical. Acts like GDPR or HIPAA ensures that patient data is handled safely and ethically. They build public trust, which is essential for data sharing, contact tracing, and artificial intelligence assisted diagnostics. Then comes the certification schemes. Not all tools are created equal. Certification schemes for electronic health records, telemedicine platforms, and artificial intelligence medical devices. It makes sure that the technology is safe, reliable, and interoperable. Essentially, it is a quality stamp. And in collaboration, we know that collaboration is the key. So, public private partnership often includes open source or global goods. Clauses, it means solutions can be shared and adapted. It encourages innovation while avoiding duplication of effort. In digital health investment reviews, before investing in any project, ministries of finance review the digital health investment cases. This prevents the fragmentation and ensures resources are used efficiently, making sure every project contributes to national priorities. So, the summary is think of these instruments as the tools in a toolkit. The strategy sets the plan, committee coordinate the team, privacy laws protect the people, certifications ensure quality partnership that brings in extra hands, and investment reviews make sure money is spent wisely. Together, they turn scattered digital health initiatives into a coordinated, trustworthy, and effective health system. Policy levers are the concrete tools or control knobs that government and other authoritative actors can deliberately adjust to change how a health system behaves, who gets what care, at what cost, and with what quality. You can take this as the adjustable dials on a control panel. When you turn one, incentives, resources, or rules shift, and the system performance moves in response. Governance levers in health systems are a little bit difficult to understand, so we will concentrate here. Think of a health system as a machine. To make it work well, policymakers use different levers. Each lever adjusts a different part of the system. First is the financing, where the money comes from. The financing lever determines how healthcare is funded and pooled. It could be taxes, social insurance, donor funds, special taxes on things like tobacco or sugar drinks. This is the fuel that powers the health system. Without it, nothing runs. Then comes the payment. How providers get rewarded. Like payment shapes how doctors, nurses, and hospitals are paid. Fee for service, salaries, bundled payments, or pay for performance all influence how care is delivered. If you reward the right way, providers are motivated to deliver high quality, efficient care. Then the organizations, it deals with who runs the system and how. Organization defines who owns, manages, and coordinates care. This includes public-private partnership, referral networks, task shifting, and telehealth integration. Good organization ensures patients get the right care at the right place at the right time. In regulations, which is also called the rule book, regulation is about setting and enforcing rules, licensing, accreditation, price controls, quality audits, and data privacy laws. It protects patients and ensures safety, quality, and fairness across the system. When we talk about the behavior change, like changing habits and norms, persuasion leverages information, norms, and trust. This include health literacy campaigns, professional guidelines, public score cards, or nudges. It helps both providers and the public adopt healthy behaviors and follow best practices. Digital e-governance is not a separate lever. It enhances all the traditional governance levers. For example, digital tools speed up financing through electronic claims, verify payments with blockchain, allow national electronic health records to connect rural and urban providers, enable real-time algorithm audits for regulation, and send SMS reminders to influence behavior. In short, digital health makes every lever faster, smarter, and more transparent. When deciding which governance lever to pull, policymakers ask a few questions. Which outcome matters most? Is it access, quality, cost, or trust? Which levers are politically or legally feasible right now? Do we need quick wins like adjusting payments or long term reforms like reorganizing care delivery? And can digital tools amplify the effect safely? Answering these questions turns a long list of possible actions into a prioritized, time bound reform plan. That's what we mean by pulling the right policy levers. Here is a table that shows real world examples of how different policy levers are used to shape digital health. Each row represents an initiative or guidance and the lever it pulls, whether that's payment, financing, regulation, organization, or persuasion. For example, the first one CMS, HCPCS codes, and AMA CPT codes are payment levers. They create reimbursement pathways so clinicians are incentivized to adopt new digital tools. The CMS TCET pathway mixes regulation and financing. It fast tracks coverage for breakthrough devices so money reaches providers quickly after FDA approval. Then is the FDA PCCP guidance and strengthened cybersecurity rules are regulatory levers. They make sure AI or digital tools are safe, effective, and monitored in real life. Europe EHDS and NHS Digital Transformation Funds are organization and financing levers. They restructure how health data is shared and who can access it while funding infrastructure. So, did you see how these initiatives work together? They are not working separately. Payment encourage adoption, regulation keep tools safe, financing provides the money, and organization shapes the system. Together, they show how governments and standard bodies guide digital health to be safe, funded, and connected. Transitional coverage for emerging technologies. It is a special pathway by the Center for Medicare and Medicaid Services for FDA approved breakthrough devices. It lets patients access these innovative medical devices faster through the Medicare, even while more evidence about their effectiveness is being collected. However, not every software as a medical device qualifies. Only those that fit into an existing Medicare benefit category they qualify. United States Food and Drug Administration, it has set clear requirements for the evidence needed to approve medical devices. Real world evidence can be used, but it must meet a very high quality standards. Some type of devices may also receive customized guidance. It depends on their technology and the risk level. In telehealth coverage, Medicare has permanently expanded coverage for the behavior telehealth because evidence shows that it helps manage chronic diseases and improves the equity. Coverage rules such as where care can be delivered, which providers can offer it, and how they are reimbursed, they vary from country to country. Data governance and policy ensure that health data is handled safely, responsibly, and legally. Key principles include here are the purpose limitation. It means that data is used only for the intended person. Data minimization, collecting only what is necessary. And consent, patient agree to how their data is used. Practical measures include audit trails to track data access controls to limit who can see it, and data residency policies to ensure data stays in approved locations. All of this must align with national privacy laws and follow World Health Organization best practices. Cybersecurity in digital health requires the regular vulnerability assessment, timely software patching, and clear response plans for the incidents. It should be considered during procurement and throughout the device lifecycle. Coordination with National Computer Emergency Response Team help manage threats effectively and protect the patient data. Recent digital health updates include the final prescription digital therapeutics and remote software labeling guidance. It clarifies drug and software use. We are also seeing the wider adoption of reimbursement codes for digital therapeutics and remote therapeutic monitoring. Additionally, the FDA provides artificial intelligence and cybersecurity guidance, while the European Union invests in workforce and funding initiatives to support digital health implementation. This table is like a toolbox for digital health governance. Each step gives policymakers a ready-made template instead of reinventing the wheel. For example, WHO strategy canvas helps you set the big picture and KPIs. Let's look at these examples one by one. The first tool is the National Digital Health Strategy Canvas. Think of it as a master plan. It sets the vision, the targets, and the budget so everyone knows the direction. Second is the Digital Health Investment Case from the World Bank. This is how government separate real value projects from the shiny distractions. It helps stop the disease of pilot cities where projects never scale. Third is the open source maturity checklist. This one answers the golden question: should we build something new, buy it, or reuse existing free solutions? It keeps countries from wasting time reinventing the wheel. Fourth is the interoperability conformance profile. Imagine apps and systems as different languages. This tool makes sure they all speak the same language. So a maternal health app can talk to a diabetic app. Fifth is the data protection and cybersecurity playbook. Instead of writing complex legal clauses from scratch, countries can just pick this up. It guarantees privacy and security are baked in from the start. Then is the health data governance canvas. This one clears up the confusion of who owns data, who gives consent, and how data can be reused. It builds trust, which is essential. Seventh is the regulatory sandbox. Picture a safe playground where innovators test new AI or medical software under the watch of regulators. The benefits evaluation framework from NHS. It answers the questions. Did this project really improve outcomes and save money, or was it just a hype? Ninth is the change management and workforce kit. Because technology fails if people resist it. This kit trains health workers and helps them adopt smoothly to digital changes. Tenth is the procurement clause library, a lifesaver for governments. It gives ready made legal clauses, so every contract demands interoperability, security, and openness. 11th is the TCET style coverage pathway. This is smart. It lets government start paying for new tools while evidence is still being collected. So patients don't have to wait for years. And finally, the governance scorecard. Think of it as a report card for countries, measuring progress every. While making a policy, the policymakers should keep in account the following details. First one is the roadmap. Imagine a Google map for the health system. A national digital health strategy is the navigation system that tells a country where it is, where it wants to go, and what digital routes like telemedicine, electronic health record, and other apps will take it there. Without the map, everyone drives in circles. Then comes the privacy law. Privacy law is something like the lock on the diary. Think of your medical record as your personal diary. A privacy law is the lock and key that ensures only the right people, like your doctor, your nurse, can open it. Without this, your private thoughts or health details could be read by anyone. In procurement rules, buying software as a service, which is called SaaS, for healthcare is like shopping for your hospital online. Procurement rules are the shopping list and budget plan. They prevent overspending, ensure you get quality, and keep you from buying a glittery app that looks good but doesn't work in your clinic. In health technology assessment, which is the HTA process, we do the quality check. Before buying a new machine or app, the HTA process is like a test drive for a car. You check, does it save money? Does it actually improve health? Is it safe? And HTA ensures you don't waste millions on technology that looks fancy but doesn't deliver the actual results on ground. Interoperability policy is like different languages but has one translator. Imagine every hospital speaks a different language. One says sugar, another says glucose, another says it's C6H12O6. Interoperability is like having a universal translator that makes all systems understand each other so patients don't get lost when moving from one hospital to another. In cybersecurity plan, in ancient times, the cities had walls and guards to keep invaders out. Today, hospitals need a cyber wall and digital guards. A cybersecurity plan protects health data from hackers, just like a fortress protects its people from the enemies. As we wrap up, remember this that the good governance is the key that unlocks scale in digital health. When reimbursement, regulation, standards are aligned, innovation does not just stay on paper, it reaches people. We must also keep investing in interoperability, workforce skills, cybersecurity, and equity so no one is left behind.